Hello and welcome to the show. Tonight, one Midwest community is yearning for your votes in their quest to become Riderville. The Thorpe Recovery Center went on the road last weekend biking from Lloydminster to Saskatoon. They make a pit stop here in our studio, but first, healthcare gets a boost in Meadow Lake. We sit down with the woman in charge. All that tonight on Around the Region. Thanks for joining us on this Thursday edition of Around the Region. With me in studio is Glenys Uzelman. She's the Primary Health Services Vice President with Prairie North Health, and she's coming to us from Meadow Lake today. Thanks so much for coming all the way down, making the trek.
Thank you for having me. It's a pleasure.
Excellent. Now, I hear you have some very exciting news in Meadow Lake. I'm going to let you tell it.
Well, in the 1st of December of last year in Meadow Lake, we started a primary health care clinic up there. And just very recently, we've gone to sort of our second stage of planning, and we have purchased the medical clinic and some adjacent vacant properties so that we can continue to move forward with our plans for Meadow Lake and primary health care.
Excellent. So how much more space is this adding to your healthcare?
What we're hoping to do with that space is to be able to expand it, that it will accommodate some more of our multidisciplinary team, the 3 nurse practitioners that we receive funding for, and other healthcare professionals such as a diabetes nurse educator, part-time dietitians, any other healthcare professionals that can help support the team to support our patients. As well, starting in January of 2011, we hope to go into our partnership with the College of Medicine with the University of Saskatchewan and their distributed learning model to bring 2 family practice residents and 2 medical students on an ongoing basis to Meadow Lake.
Now, how much more people do you think this will affect? How many more people do you think will be serving in Meadow Lake because of this development?
Well, we're hoping to be able to better serve the people that are there. Currently, or part of the reason for going to primary health services was the number of vacancies that we had with physician services up there and the difficulty in recruiting. So they really have been without their full complement of physicians for a while.
Right.
So the whole plan is to try and stabilize that physician group and then better utilize some of our other healthcare professionals to be able to better serve the population of Meadow Lake and area.
Right, it's one thing to buy the space and it's another to fill it with actual doctors, right? So how do you plan on making that? You just talked a little bit about the University of Saskatchewan. Talk a little bit more about that program. How is that going to bring in more of a stable doctor presence?
Well, what we're hoping is by introducing the practice in rural Saskatchewan and having our students come to Meadow Lake, they will find that that has been really an exciting way to learn and will be more prepared to want to stay. And some of our Saskatchewan residents may want to come back and stay in Meadow Lake and make that their home.
This comes at a time where Prairie North is making a lot of cutbacks. How much does this come out of the budget, and was this allotted for in the budget?
The budget, are you asking me about the primary health services or the building?
The building.
The building. There will be some out of the budget, but what we did was the cost-benefit analysis, and currently we've been leasing that building, so we feel that within a few years we would have, through the cost-benefit analysis, we could purchase and have that paid back by not leasing. I see.
So a lot of Saskatchewan communities and, well, I guess Prairie North Health communities are taking a lot of hits. So how is it that Meadow Lake is getting more investments? That's really exciting for you guys.
Well, because we really strongly believe that the way forward is with primary health care in our province. And as far as funding for the physicians, that's funding that we receive through the ministry. As well, when you go to primary health care services, the ministry has budgeted over a number of years already where they can fund the nurse practitioners. So it's not that we're taking any money out of our existing budget to do that. As far as when I talk about the other healthcare professionals, those are people that currently do work for us, and so it would be a matter of realigning some of the work that they do. There's not a lot of new resources going into this, but certainly the resources for the nurse practitioners is new money to the region.
We're going to talk a little bit more about this, but we have to take a quick break. We're just in the middle of a conversation with Glenys Uzelman from Meadow Lake Prairie North Health. Well, if you're just joining us now, we're just in the middle of a conversation with Glenys Uzelman, who is the Vice President for Primary Health Services with Prairie North Health, coming to us from Meadow Lake today. So we were just talking about a little bit of funding issues. Let's talk about some other issues that were happening in Meadow Lake before this. Was it a little bit of a struggle with space and getting people up?
The space wasn't so much the issue, although when they had their full complement of physician services there was very limited space for us to be able to introduce other healthcare professionals. And there certainly would not be space for the full-time nurse practitioners to work in that space. So certainly by buying the clinic, that will allow us to build onto that capacity.
Now this week, SEHO and their unions have also struck a deal, which is big news in the healthcare system as well. Do you think that's going to relieve some of the pressure that's been happening?
Really, from the physician clinic perspective, there would be very little impact from our negotiation or from our support staff at CUPE, but I must admit we're very happy to hear that they have settled.
Healthcare is something that Canadians just get really excited about in general, whether it's something like this where it's a new development in the town or if it's something that it's a cutback. Why is it important to have a strong healthcare centre in a community? Well,
we all need healthcare at some point in our lives. Certainly the communities people want that as a service in their community, so they feel that they have that safety net there. It does provide employment for many people. It allows them to promote their community from newborn to seniors to be able to stay there and have those services.
Now, it is kind of a struggle to keep a regular doctor, especially general practitioner, in a town like Meadow Lake. How are you trying to make that more attractive?
That was one of the reasons that we felt going to primary health care would assist us, in that the new physicians coming out don't want to have the headaches of the overhead and the running of the clinic operations.
Just as a final wrap up here, you're feeling good about this new purchase. Is it going to help the residents of Meadow Lake, you think?
Well, we hope so. The purchase is really only secondary to our plans of what we want to move forward, and that is in stabilizing physician services, adding our nurse practitioners, better utilizing some of our healthcare professionals, and providing a much more holistic service to our residents.
Well, again, thank you so much for joining us today, Glenys. It's been a pleasure to have you.
Thank you. It has been a pleasure.
We just finished a conversation with Vice President of Primary Health Services with Prairie North Health, Glenys Uzelman. Your top news headlines are after the break.